Hello friends, welcome to my new video about the reasoning questions of the respiratory system. So let us start. First question is that straining at the stool is not advisable in old age patients. Why? So during defecation and coughing, the pleural pressure becomes positive, produced by pressing over the great vessels within the thoracic cavity. That reduces the venous return to the heart and cardiac out falls markedly. Now when the expiratory muscles work against the closed glottis, there occurs a marked decrease in the thoracic volume that causes deflation of the lungs so that the cardiac output is markedly decreased and there may occur a cerebral ischemia, visual blackouts and unconsciousness, especially in old person, so that severe bouts of cough or straining at the stool may be dangerous in old person or cardiac patients. Now, exercise that often triggers the bronchoconstriction. Why? So, when you exercise, there is a loss of the heat and water or both from the airways. Moreover, you breathe faster and deeper due to increased oxygen demands of your body. So, you usually inhale through your mouth, causing the air to be drier and cooler than that what is already present in your body when you breathe through your nose. The dry and or cold air is the main triggering factor for the airway narrowing or bronchoconstriction. So symptoms typically appear within a few minutes after you start exercising and may continue for about 10 to 15 minutes after you finish your workout. Infection of right lung is more common. Why? The right side of the main bronchus has more diameter than the left side. Moreover, it is present in parallel with the trachea. Therefore, inhaled foreign body that lodge easily in the right lungs than the left lung, so that the infection of the right lung is common than that of left lung. In smokers, there is a higher incidence of respiratory infection than in non-smokers. Why? So first of all, the epithelial cells of the tracheobronchial tree are ciliated. Cilia are absent in the alveoli, where the gas exchange occurs. Now the efficiency of the ciliated cells of the trachea and bronchi in propelling mucus and waste products is of high order. Cilia beat towards the exterior, means towards the laryngeal side, and thereby preventing the entry of the foreign particles into the alveoli. This action of the cilia are known as escalator action of cilia. Ciliary escalator action is important defense system against airborne infection. Now immunoglobulin A that is secreted in the bronchial secretion and protects against respiratory infection. The dust particles in the inhaled air that are often laden with the bacteria. So while passing through the repeatedly branched bronchial tree, the dust particles and the bacteria that are caught in a mucus layer which are present at the mucosal surface of the respiratory passages and are moved up towards the pharynx by the rhythmic upward beating action of the cilia and swallowed. Now all these actions of the cilia that disturbed by the cigarette smoke in smoker subjects. So all these actions that explains that there is a higher incidence of the respiratory infection in smokers than in non-smokers. Pulmonary alveolar macrophages play an important role in the defense system. How? They play an important role in the defense system by the following mechanism. So first of all, being actively phagocytic cells, they ingest inhaled bacteria and small particles and also help in processing inhaled antigens for the immunologic attack. And pulmonary alveolar macrophages secrete substances that attract polymorphonuclear leukocyte cells to the lungs. And by some secretion, they stimulate granulocyte and monocyte formation in the bone marrow. Arterial partial pressure of the oxygen is less than alveolar partial pressure of oxygen. Why? So blood leaving the pulmonary capillary is joined by venous blood from the bronchial circulation and also from the anterior cardiac and Thebesian veins. Partial pressure of the oxygen in the arterial blood is about 95 to 98 millimeter of mercury, and which is less than alveolar oxygen partial pressure of about 100 to 104 millimeter of mercury. Now this decrease in the partial pressure of systemic arterial blood is because of physiological shunt. The physiological shunt is due to mixing of bronchial venous blood. It is about 2% of cardiac output. So mixing of the bronchial venous blood with the pulmonary capillaries or veins, which contains only purely oxygenated blood. So because of this mixing, final partial pressure of the oxygen is less than alveolar partial pressure of oxygen. And note that the partial pressure of the oxygen of the arterial blood, which is about 95 to 98 millimeter of mercury, less than alveolar partial pressure of oxygen of about 100 to 104 millimeter of mercury. In standing position, vital capacity is more than in sitting and lying position. So in standing position, vital capacity is more than in sitting and lying position because of due to effect of gravity. There is a increased size of the thoracic cavity in standing because the diaphragm moves down in standing position, and also reduced pulmonary blood flow due to decreased venous return. Why is the transfused blood not as efficient at oxygen delivery as the recipient's own blood? Because the transfused blood is generally stored blood, and the 2,3-diphosphoglycerate concentration in the erythrocyte falls during the storage of the blood, and the fall in the diphosphoglycerate concentration that shifts the oxygen hemoglobin dissociation curve to the left, and that makes it more difficult to unload oxygen or to deliver the oxygen in the tissue, so that the transfused blood is not as efficient as the recipient's own blood to deliver oxygen. In pregnancy, vital capacity is reduced because due to pushing up of the diaphragm and the reduced capacity of the thoracic cavity. Most comfortable position of the diaphragm is in sitting position. Why? So position of the diaphragm is most comfortable in sitting position because the diaphragm is down due to gravity and not pressing over the abdominal contents. This also increases the reserve volume of the lungs. Compliance of the lungs alone is greater than the combined compliance. Why? Because inside the thorax, some energy is required to expand the thorax also, so that the compliance of the lung alone is greater than the combined compliance of lungs and thorax. Lung compliance increases in old age. Why? Because due to some modification in the knitting arrangement of the elastic tissue. What keep the alveoli dry or alveoli always remains dry? Why? Surface tension. It is the main factor that keeps the alveoli dry and thus helps in exchange of the gases. Normal pulmonary capillary hydrostatic pressure is about 8 to 10 millimeter of mercury and oncotic pressure which is about 25 millimeter of mercury, and that produces an inwardly directed pressure gradient of about 15 to 17 millimeter of mercury. Therefore, low pulmonary hydrostatic pressure tends to pull the fluid from the alveoli into the pulmonary capillaries and keeps the alveolar surface free of fluid. So in this way, the alveoli always remains dry. Numerous allergens that causes bronchoconstriction. Why? So numerous drugs and allergens cause mast cell degranulation with the release of the large amount of the histamine. Now this histamine released binds to the histamine receptors that are present on the bronchial smooth muscle and that produces bronchoconstriction. Defective ciliary motility causes stasis pneumonia. Why? So defective ciliary motility impairs the mucokinesis that leads to retained secretion that provide an excellent medium for the bacterial growth and that causing a stasis pneumonia. The retained secretion also cause plugging of bronchioles and that also leads to atelectasis of the connected alveoli. Small airways have laminar airflow. Why? Now the small airways are with very small diameter and extremely low velocity. Both are the cause of the laminar flow in small airways, and also the velocity is the more important than the diameter, so that the small airways have laminar airflow. So if any questions about this lecture, please write down in comment section and you can ask me any questions. And thank you for your attention.